Thank you to Colleen, a Levittown native and an emergency department nurse at NYU Winthrop Hospital. Thank you to Frank, a sanitation driver for the Department of Public Works. Thank you to Jocelyn from Selden, a nurse at Huntington Hospital. Thank you to Courtney, an RN at NYU Winthrop Hospital. And thank you to James, an NYPD officer from Merrick. Are you an essential worker or know someone who is? And we want to hear from you. All we need is the picture, the person's name, the village or town, and what that person does for a living. Every night, right here at 7, we will be thanking the people who have been on the front lines during this pandemic. Just go to the News 12 Facebook or Twitter page. Good evening, I'm Stone Grissom, and welcome to our live coronavirus pandemic special report. Well, tonight we have a doctor from Cohen Children's Medical Center to help you sort through what's going on with COVID-19 in our communities and across the region. And of course, every night we want to hear from you. This is a call-in show, so please call in. The number's right there at the bottom of your screen, doesn't change, 516-393-1800. Well, no mask, no entry. With the reopening underway, Governor Cuomo says he'll sign an executive order that would allow businesses to refuse service to anyone who refuses to wear a mask. Cuomo says people have the right to not wear a mask, but they don't have a right to go into a private business and then risk infecting everyone inside with COVID-19. He says a store owner does have the right to protect himself and the other patrons in that store. All right, let's go to the numbers right now. There are more than 366 confirmed cases. That's statewide. Look at the Long Island numbers, about 80,000, almost 80,000 right here on the island. Now, Nassau County Executive Laura Curran says COVID-related hospitalizations, though they have dropped for 46 straight days. And in Suffolk, Executive Balone says the number of hospitalizations and patients in ICU beds, that also continues to decline. Now, unfortunately, the governor also said COVID-19 will remain a cause of death for the foreseeable future. Another 74 New Yorkers lost their lives to the virus. That was just in the last day. That and the day before, same number. The death toll is nearing 24,000 statewide. Now in Suffolk, officials say over the last 24 hours, another 10 people died from coronavirus. And almost 4,000 deaths in total. That's just right here on Long Island. All right, let's get to our conversation. Joining us tonight, again, is Dr. James Schneider, Chief of Pediatric Critical Care Medicine at Cohen Children's Medical Center. Thank you so much. Do you even remember the day all this started? This must seem like one really long day. How are you holding up on this?
Thanks for asking, Stone, but things are going fine. We're kind of getting used to the new norm. It feels like it's been ages. It actually hasn't been that long. It's only been about 4 months, I guess, but it seems like an eternity.
Yeah, so I know at your part of the Pediatric Critical Care Medicine, you see, is this right, the highest percentage in the country of children with COVID-19?
Right, well, we've had over 100 children already admitted to our hospital alone with some COVID-related illness, which is one of, if not the highest in the country. And our intensive care unit has already taken care of more than 10% of the country's pediatric ICU population.
So, wow, that's incredible. All right, let's get a couple of questions in. Deborah from Farmingdale. Deborah, you there?
Yes, I'm here.
What's your question tonight?
Hi, thanks for taking my call. I have 2 kids, 4.5 and 18 months, and I am planning to send them back to daycare when they open on Monday, June 1st. And I wanted to hear what you thought about that. I am having nervous feelings and whatnot, but they ensured that they're taking all the CDC guidelines, masks, face coverings. I want to hear your thoughts.
Yeah, thanks. It's a great question. I'm a father myself of 2, and what to do with our children is important. It's really critical as long as any healthcare or any child care offices or centers, as long as they're following the CDC guidelines where everyone's wearing masks, where there's no overcrowding, where children and staff can be maintained at the appropriate distance apart. Particularly this time of year, if they could spend some outdoor time, we know there's less risk of transmission in the outdoor setting where air is moving. That's good too. I think it's the balance, and definitely good hand hygiene there when you're home is really critical. So I think it's important to know your place that you're sending your children and have a communication with them and conversation. As long as they're following the guidelines, I think it's not unreasonable to start getting back a little bit to life.
And Doctor, let me follow up on that question. As we're in phase 1 right now, I know at least in Nassau County they're proposing having outdoor seating in restaurants. Is that, from a medical standpoint, are we at a spot now where we can start doing that kind of stuff?
Well, I think it's quite reasonable, frankly. We know from our data now that the risk of transmission is definitely lower in outdoor settings. A lot of it has to do with just the air movement. And so there's really less virus in the air because it does have the ability to continue to move. So, and as we still have to maintain, though, some level of, again, social distancing, wearing masks. There should be good hand hygiene. So I think it's completely reasonable at this point to start working that way. We see the numbers are finally starting to trend down because all of these measures have been working, thankfully.
Okay, that's beginning of some good news. Let's go to Wanta. Ann, are you there?
I want to ask a question.
Yes.
If a family of 4 went to an outdoor movie and stayed inside their car for a 2-hour movie, and one person in the car was asymptomatic, how safe could all of the passengers be, as that is not 6 feet social distancing?
So if I understand correctly, if you refer to one of the 4 people actually having the infection, even though they're asymptomatic, if you're all sitting in a car, I would think that actually is a fairly high-risk situation to transmit it to the other 3 individuals because of the close confined space within a car. If nobody has the infection, then that's fine, knowing that we all live in our houses with our families. I think drive-ins are a great idea, again, where you can actually sit outside the car perhaps, which again decreases a little bit the risk of transmission.
Yeah, who knew? Drive-ins went away for a while, and it took a pandemic like this to bring them back. Who knew that?
I missed them.
I know. All right, so let's go to Seaford with Fran. Fran, you there?
Yes.
What's your question tonight?
Hi, Dr. Schneider. Thank you for taking my call. My son has a chronic autoinflammatory disorder called PFAPA, where effectively his immune system overreacts to inflammation in his body. Do we yet know if children with existing autoinflammatory conditions are at greater risk for developing MIS-C?
So that's a really great question. Right now, with the data that we currently have, and I could speak more specifically to our institution's experience, and we pretty much have had the largest number of children with MIS-C in the world for any institution. And really what we've seen is that this condition is occurring in previously healthy kids without any known risk factors right now. So even though we know that acute infections with either COVID or other types of bacteria or viruses, children or adults who have immune-mediated or underlying conditions tend to be at higher risk, we haven't yet identified with MIS-C that the same is true. So I think I'd maintain the same level of caution.
So, Doctor, and just to clarify, because I think we've been using different terminology up to this point, MIS-C is the new term for what we were calling this multi-inflammatory syndrome?
Right, that's right. So when this first was brought to our attention as a medical community back at the end of April, there were different iterations of diagnostic criteria, different names, and it was becoming commonly known as Pediatric Multisystem Inflammatory Syndrome, or PMIS. More recently, though, the CDC and the World Health Organization have come up with case definitions, and now they're calling it the Multisystem Inflammatory Syndrome of children associated with COVID-19. So MIS-C is the most common and most recent terminology we're using.
Okay. How about Ronkonkoma Carol? You there?
Hi. Yes, I am. Hi. How are you? Thank you for taking my question.
Absolutely. What's your question?
Okay. My question is, my husband and I both had the virus. Okay. We're better, thank God. I had it bad, he didn't, and we've been better for weeks. My question is, we go to see our grandchildren outside. We will not go in the house. We have our masks on. We have gloves on. The one I'm concerned about is my 4-year-old granddaughter. She won't wear a mask, but we have contact with her outside. But she comes up to us and she wants to hug us. So are we doing anything that's harmful to her?
Well, if you had the infection, and thankfully I'm glad to hear that you both recovered and are doing well. one thing we don't know is whether or not, definitively, whether or not if you've had the infection, if you can again get infected. So I'm glad to hear that you're wearing your masks when you're out in public. So whether you are a risk to her is still not totally clear. With the hope that you're not infected anymore, you're not a risk to her. Now, we have to remember wearing masks both protects yourself, it does protect those around you, and so it is a good idea that you're wearing a mask. Ideally, again, it's really important as best we can to maintain some level of social distance, but if you are closer, wearing the mask is key, and definitely washing your hands well. I would caution the use of gloves because they tend to give a false sense of security. As long as you're washing your hands well, not touching your face, your nose, etc., then you're okay.
And doctor, let me go back to an earlier question about the sending their kids to daycares. If we're doing that now, we're starting, and potentially schools might reopen
Right.
for the fall. What would be your medical advice for what do you do when your kid comes home from school to keep you safe, to kind of disinfect everything?
Sure. Well, I think what's really important, particularly for kids, is because they're notoriously not great at hand hygiene, is to, first thing you do, and when they come off the bus or they walk in the house, go right to the sink. A good 20-second scrub. Hand hygiene is really probably the most important thing you could do. What I do at home is we leave our school either shoes, or at least now for myself, my wife's a nurse, so when we come home we leave our shoes outside, we leave our bags outside, and we go in and we change immediately and get a shower, and then we go talk to the family and spend time together. So it's really about good hygiene. Until we have a way to prevent infections, it's all about maintaining the best hygiene we possibly can.
Okay, that's going to be the new normal for a long time, I'm sure.
So,
all right, let's Margaret, are you there? Margaret?
Yes, I'm here.
What's your question tonight?
My question is, Doctor, are you familiar with a recent report that came from Italy where a group of doctors, against the advice of the World Health Organization, did autopsies on some of their patients, and they found that it actually was not a virus at all that was causing the COVID, but it was a bacteria that was causing all these clotting problems in DIC. And when they changed their protocol to address this and use anticoagulations, antibiotics, and anti-inflammatories, that they discharged 14,000 patients in one day.
Okay, so we're going to take a real quick break. I'm going to let the doctor think about that. We'll have him answer that question right at the other side of the break. We're going to have much more expert advice on how to keep you and your family safe from the coronavirus. We do want to hear from you, so call in with the questions. That number's right there at the bottom of your screen, 516-393-1800. Welcome back to our live coronavirus pandemic special report. Let's bring back in Dr. James Schneider, Chief of Pediatric Critical Care Medicine at Cohen Children's Medical Center. So before the break, Margaret from Massapequa, she was talking about a study or an article from some kind of study in Italy where they found the virus was a bacteria. One, have you read that? And two, do you know anything about that?
So I actually have not yet seen that study. It is pretty fascinating. I think it really just speaks to the ongoing and emerging data that we as a community continue to learn about this acute COVID infection, of course, an MIS-C, that's a post-COVID infection. There are plenty of data out there that clearly identifies COVID as the etiology or the source of this bad illness. However, if there are new data that suggests that there are other components to the illness, this is really good to understand and share. So I appreciate that question, and we'll continue to learn together as a community.
Yeah. Also, there was a recent study out of LSU Medical Center in New Orleans about the African American community. There were 10 people with blood clots on their lungs. What is that telling us about the minority community and how it's being hit? Or do we know it yet?
There are a couple of things about that. First and foremost, we do have enough adult data now that really shows that African Americans, minorities, certain socioeconomic locations, they are clearly more affected than other areas. And we can even see that on the New York State map and even New York City map. So there are definitely higher risk populations. But we do know also very clearly, and I could speak to it from personal experience of caring for patients, that there is a very obvious tendency towards clotting in patients who are acutely affected by this coronavirus. We're still trying to figure out why. And to the previous question, we do treat almost every one of these patients with blood thinners, but that's an evolving process. What we did 3 or 4 months ago is a little different than what we're doing now because we're learning more and more.
Yeah. All right, let's go to Deer Park. Marie, are you there?
Yes, hi, Marie, and thank you, doctor, for your service and taking my message. I live in a 2-story house. My tenants had the COVID virus 4 weeks ago, and I had it 2 weeks ago, and I live with my brother. We share the same duct system in the house for the heating and air conditioning. Do I need to clean the duct system because of the virus so it will prevent my brother from spreading it, the virus?
That's a very interesting question and very thoughtful question. I'm not aware that, and I haven't seen any recommendations from the CDC or the Department of Health related to duct cleaning. When there is air moving, it tends to kind of dilute or decrease the overall amount of virus in the air that lingers, and so just air movement is very helpful. I would suggest, personally, I think keeping windows open this time of year is a great idea because that helps to keep air moving as well, rather than just because if you look at just air conditioning systems, it just recycles air, so it doesn't necessarily get rid of the virus from the air in the building. But if you open windows, you can have the same air movement, yet you get fresh air.
Oh, all right. How about Roseanne? Roseanne, you there? Is that Roseanne, or maybe Chuck is there? Chuck, are you there? Chuck or Roseanne?
I'm Chuck.
Chuck, what's your question tonight?
Okay, my question is, my wife has COPD, and I'd like to know if, with things opening up, if she's able to now leave the house, go to a store, and most of all, visit her grandchildren.
Yeah, so we know, Chuck, I'm sorry that your wife does have COPD, and having underlying chronic respiratory conditions will definitely increase the risk if she were to get infected. So I think if she's going to leave the house and get back into the community, it's really important that she still maintains the same level of vigilance about wearing a mask, about social distancing, about hand hygiene. That's really critical, and also making sure she continues to really be very strict with following the regimen that she's using to treat her COPD to keep it under control as best she can.
Okay. How about Michelle? Are you there, Michelle?
Hello?
Roseanne.
Yes.
Oh,
hi.
there you are.
Yes,
we missed
I
you
am.
before.
Okay, I also have COPD, but I also teach and swim at a scuba diving pool. It's publicly owned. They're not open yet, but she's planning to reopen. Will I be safe teaching and swimming there?
So the safety, I think, is going to be related to how many people are there, how close you all get. If you look at the CDC, and both the DOH and the CDC have some great information on their websites, but we don't have any good data to show that the virus can be transmitted within the water of pools. However, if to go to a pool, that implies that you're around a pool, and so if you have a big class of students and you're going to be sitting on the pool deck talking and teaching, then you still need to maintain distance as best you can. I would definitely suggest wearing a mask as well, and so there's definitely still a risk even though you're around a pool.
All right. Well, unfortunately, that's all the time we have. Thank you again, Dr. Schneider, for coming onto the show and for everything that you do every day. One of the heroes on the front lines, and certainly a friend of the show, coming on and giving us your expertise. And thank you, viewers, for watching and for your calls. And we're going to see you right here tomorrow at 7 o'clock.